Arizona's family closely monitors the coronavirus. We do want to remind you of the symptoms to help tell them apart from, say, cold or flu. They are mild to severe respiratory illness with fever, cough, and difficulty breathing. But is it an easier way to tell the difference, or is there? Dr. Scott Anderson is the Chief Medical Officer for Banner Boswell and Banner Del Webb Medical Center and is on the phone with us this morning to try to clarify some of this. And, you know, I know around my own home, I have asthma, I have seasonal allergies, my husband has valley fever. I mean, we cough and we sniffle. How do we know when we're entering into a zone where we're at risk potentially of showing signs of coronavirus, and when and where would we be tested?
Well, good morning, Olivia. You're absolutely right. We are entering the beginning of flu season here. So many people have a sniffle, sore throat, runny nose, and it's real easy for people to get confused with the symptoms. And there's so much misinformation, so much fear in our community right now, and people want to have a plan. They want to know what to do, and that's really the right approach. I think, as you were mentioning earlier, the most important thing for us to keep in mind is that the vast majority of Americans and people who have been having this really have had a reasonably mild course and have not required hospitalization or ICU care. And so for most people, what we're advising is the same thing. Stay home. Treat the symptoms just as you would any other mild respiratory illness. We're really encouraging hand washing, social distancing, or avoiding sick contacts, and all of the preventative measures that can keep your family healthy. There are some wonderful resources in our community, and I always refer people to the CDC websites, the Arizona Department of Health websites that kind of talk about some of those warning signs to look out for. And we worry in particular about our higher risk populations. Those individuals of advanced age or with significant underlying medical conditions, particularly in their heart and lungs. Those patients, if they see their symptoms really starting to develop and worsen, we're asking them to give a call to their healthcare provider. And that's something I really want to make sure we're really clear on is call before you go in. We definitely have testing available. All of our Banner clinics, urgent cares, emergency rooms are equipped to test for COVID-19. But we're also following the guidelines from the Department of Health Services and from the CDC. And so we're making sure that we're testing the right people at the right time.
Dr. Anderson, maybe I have missed this detail, but I haven't heard a description of how the test is administered. Is it a swab of the nose like influenza? Is it a blood test? Is it something else?
It is a swab. It's actually very similar, almost identical to the influenza swab. So you're correct in that. And typically what we're doing is we're actually ruling out influenza first. We all have had those flu swabs, and we get really quick results with those. So patients who have significant illness are often getting that influenza swab, and then, if appropriate, a second swab. And then that second swab is actually sent for COVID if it meets the criteria. So it is an identical process for the patients when you're undergoing it. It is not a blood test. It's a swab that we're using as our screening test in the community.
Dr. Anderson, I know initially when we were hearing about this, there was a fear that there would be a run, say, on not enough ventilators in hospitals if this really becomes a crisis mode locally, say. Is there anything that we should be aware of, say, if you suffer from a respiratory illness? Would you encourage maybe your patients to refill their prescriptions of maybe an inhaler or take any extra steps in advance? I mean, we see shelves of toilet paper wiped out. I mean, what about those who are chronically struggling with a respiratory issue?
You're right. Our high-risk populations, we really want them to self-isolate as much as possible. And so getting those prescriptions in advance, those essential medical needs or personal care needs that you need so that you can avoid potential contact in the community. And when you do need to go out, making sure that you're washing your hands, you're trying to keep a reasonable distance from anyone who might be ill. Those things are really important to us. And then also avoiding touching your eyes, nose, mouth with unwashed hands, especially when you're in public. We want people to have the supplies that they need. We want them to protect themselves.
Dr. Scott Anderson, a calming and knowledgeable voice on the other end of the line, so we sure appreciate your insight today and guidance. stay healthy for
Absolutely,
you
Olivia.
too.
Thank you, and you
Thank
stay
you.
healthy as well. Wash your hands, okay?
Definitely.